This time around, we get to talk to a parent who's been doing the move, who has the capability of explaining what the process is when you have a trans child, how to enroll, and how to acclimate teachers who've never had a trans child. I want to introduce you to Lori. Lori, welcome. When you move into a new school district, into a new place, the procedure going to the office and saying, this is my child, and she needs to be in this class. And in this case, we're talking about getting into the 7th grade. Mm-hmm. But this falls into place with every grade that you can ever imagine. The response that you get from the office is usually what?
I definitely can't answer for every school, but the front office is definitely a good place to start with the overall temperature of the school. That's
right.
How I would say it. You can tell right away, I would say, which schools have had training, sensitivity training, or any training really in general in dealing with these issues, just based on the way they answer your questions when you first start talking to them. If you find that they clam up right away, then you might have to do a little bit of extra work educating them, and it may just be that they haven't had the training, like I said.
Okay.
But often the front office will know what to do, and they will be welcoming. Often they will get you in contact with their counselor. Obviously, the school counselor is going to have a lot to do with most of it, and your administration, your assistant principals, your principals. Right. And you have to start there and then work to the teachers and everybody else involved.
What I see is that the procedure shouldn't take that long.
Yes.
It's like enrolling anyone.
Right.
But you're right. If the office hasn't had the sensitivity training, then there's going to be that wall that you have to break through.
It's almost like a fear, like they're like, oh, I want to do this right, but I'm just not sure what to say.
Right.
So it's never really a fear in a bad way. It's more that they really want to do what's right. They're just maybe not sure how to go about it.
Once you get past that firewall, what's the next step?
Enrolling is, like you said, it should just be just like enrolling any child. But after you're already enrolled and you're going to be starting in that school, you do want to set up a meeting with the administration. That's where I've started every time before I've even gone to the teachers. At the middle school level, your student's going to have many different teachers. It may not be the same one at the high school level as well.
Right.
But at the elementary level, they usually just have 1, 2, maybe 3 teachers. But at the middle school level and high school level, administration has control really over what teachers your child is going to be placed with. So I went to the admin to kind of set up just a meeting between us so that we had a game plan. These are the needs that my child's going to have. What teachers do you know are supportive? What teachers do you know are not supportive? Please don't put my child with that teacher. Right. Obviously. We don't want to make anybody uncomfortable, much less the teacher or the student. Mm-hmm. Our students have the rights just like every other student, but if you know there's going to be a problem, you don't want your child to have to suffer the entire year forcing a topic. So that's where I started. I started at the admin level. We met with the assistant principal, the counselor, and the school nurse, because the school nurse, in our case, had a lot to do with everything that we were doing there.
That's a plus.
Yes.
That's always a plus. So once inside the school, is there kind of like a maintenance period that you have to go through, like once every 6 weeks when the school report comes out, the report card comes out, and you have to meet with the teacher? When you sit with the teacher, oftentimes it should only be about the schoolwork.
Exactly. I found at the elementary level, there were certainly a lot more challenges in regards to this, where I had to meet with the teacher in regards to this topic. At the middle school level, it really has been more to do with just the scholastic aspect of things, and that's what you want.
Right.
That's what this should be. You shouldn't really have to meet with them in regards to anything else, but you do want to mention to the teachers, and I did in an email in the beginning when I introduced myself and my daughter, just basically to let them know we're all trying to keep this child safe. Can we all kind of help each other out? If you hear something or see something that maybe is a flag to you, if you could just shoot me an email, let me know if there's something I need to keep an eye out for. And I mean, you'll find that most teachers want to protect all their students. Mm-hmm. So if they just know that they have one little extra aspect that they are looking out for, you'll find that teachers will usually email you if there's a concern that they've seen. They'll not only let you know, but then they'll also let their assistant principals know, or counselors if they need to. And that's if there's like a behavioral aspect in regards to your child being trans, which would be bullying or something along those lines.
So that actually will extend itself out in a positive way, because now you have the teachers not only looking out for your child and theirs inside their realm, they're also teaching others that bullying is not acceptable, that things that are inappropriate in a classroom are no longer acceptable. And that becomes that I guess you could call it a teaching tool.
Absolutely.
That they never get at the college level. So
and it's been great. I mean, with her school, in that specific topic, I've found that teachers that I didn't even realize they don't have a very specific one-on-one interaction with my child. They may have the biggest class of 80 kids or something. Let's say it's PE or something where they've got so many children. And yet those teachers have proven to be the most protective and have utilized the situations as teaching moments, not just for the kids, but also fellow teachers, fellow coaches, fellow staff.
And so if you were going to talk to someone in the military who has to be deployed to or from, and the core of the family has to stay someplace,
yes.
What would be the strategies that you would give them to stretch out into their own realm?
As I was mentioning before, like changing schools and losing your sense of community is scary in regards to any child. So it's hard when you're military and you're starting in a new place in any situation. When you have a trans child, obviously there's that extra layer, just little layer of protection that you want to keep an eye out for. But my biggest bit of advice is just to always have open communication. I find that I would rather give too much communication, and it's not negative communication, it's positive communication.
Right.
Letting the administration know, the front office know, letting them know that you're there, you're available, you're open to talking. Because there are so many aspects of education, and there's so many staff members that are going to be part of your child's life that you really don't even think about until it becomes an issue. For example, if you have a trans child who's going to school and is going by a different name than their legal name, when you call that child out, you're going to have to, are you using their legal name or are you using the nickname that they have? Right. So then you're going to need to speak to the attendance clerk and the person that you takes your call, maybe the receptionist. There's a whole line of people that are going to need to be in the know and protective of your child. Otherwise, what if you're in a doctor's office when you're calling your child off? Do you want to have that long conversation, on the phone with them, or do you want them to already be knowledgeable? Right. That this is this person's parent, they're calling this person out sick. That's just one example. So my biggest bit of advice is just communication. Go in, introduce yourself. Supply everybody with your contact information. Here's my email address, here's my phone number, or text, however just make yourself accessible. Right. If you are accessible and they can come to you at any point with any question, I think that you'll find that it puts them at ease and it puts you at ease because they're going to come to you if any kind of a situation comes up. But it also makes everything kind of very streamlined and you learn from each other, and then it just becomes like the next year that you are enrolling, it's no big deal.
So there would be a question of what's the most unusual situation you had to contend with so far?
The yearbook is an unusual situation. And that's because depending on whether or not you have ever purchased pictures for your child before, if your child went by a different name, even at a different school, some of the schools, there's really only one or two major school photo companies that are out there, okay? Right. And they do kind of bind to your student's name because when we lived in a different city, we ordered from the same company, and they have my email address and my child's names and their grades. And then when we moved here to Texas, they still had my information based on my email address, but they also had my child's name and my child's previous name. So when I went to order pictures later, I had a very hard time getting them to figure out how to get the pictures of my child to me based on the name versus the nickname. And then you have to call later on, because those first pictures that they take are the pictures that they use for their identification purposes later.
Okay.
And usually the fall pictures are what they use for yearbooks. So you have to speak to whoever's running the yearbook later that year, because it auto-populates their legal name into the photos. And so unless you want a major faux pas on the yearbook, you have to call them and kind of really be on them. Hey, don't forget, please don't put this name in the yearbook, put this name instead. So that's super important, but that's the weirdest thing I've ever had to deal with so far.
Okay. Makes sense, and it's something that really is vital for every parent to understand, military or private citizen. You just have to be diligent with things like that.
Little details.
Because that's, well, yeah, it's all about identity, right?
Yes.
Okay.
Yes.
Are there any last things that you want to add into this? Because I know that this conversation could probably last for hours.
Oh, it could, yes. Just, I know that there are some situations that happen that can be scary when you have a trans child. Bullying is something that you do have to stay on top of. And when you have a very good relationship with the administration and with the teachers, you can't necessarily stop every instance of bullying. You can't, because you can't control every student, right, that goes to school with your child. But the things that you have control over are how you're notified and the child that you are sending to school. You know, I can help galvanize my child's self-esteem before I send her to school. I can set up a nice little network of trusted adults at that school that she can go to. And by putting that into play, usually if you've had good communication and a good relationship with all the teachers, those situations are less traumatic, I think. Okay. That's probably my best advice, because that's the situation you're going to deal with at any school you go to.
I've only had to go from one school to junior high and then to high school, so I didn't have to make that whole move. But I remember all the kids that I went to school with who were military. Yes. My God, there was one in particular who went to, by the time she got to the 9th grade at our high school, she'd already been to 17 different schools, because that's how the military moves people, because Dad was in intelligence and had to go all these places. Wow. And so 17 schools, my gosh, you know what?
That's so tough.
And so when you couple that with the fact that you have a trans child and you need to go to each one of these front offices literally and say, look, we need to create a little bit of a network.
Yes.
Yeah. And 9 times out of 10, that's going to work.
Absolutely.
Because they always want to be able to protect.
Absolutely. They don't want problems. They all want things to travel as smoothly as possible.
Right.
You know, everybody wants what's best for the students, but nobody wants to have to suffer at school. Not the teachers, not the students, nobody.
Okay.
So they will definitely, if you tell them that you really want to work together, I don't usually approach them aggressively. Like, I come in with a positive attitude, with an optimistic view. Okay. And I think that's made all the difference.
That's probably the best set of advice that we've had from a parent talking about trans children. That they're very special, they're all talented, they're all incredible, and need to be treated just like anyone else. I mean, that's the bottom line, is everybody needs to be treated fairly and in equity. Yes. Wonderful advice. And like I said, we could go on for hours and just start picking apart little scenarios that could happen, right?
Yes.
You know, and I'm sure for a military family there are those issues that will crop up from time to time.
I haven't myself done it yet, but I've had plenty of friends with their trans children travel with not just a passport, but also the birth cert or a passport, maybe some kind of a military ID. just so they have two forms of identification with the name. If it doesn't match the gender, you explain why. And they've been, I haven't heard anything horrible in regards to children traveling, so.
Well, I'm sure that from time to time, as we go through this whole process and the series talking about military and trans, not only from an adult standpoint, but having trans children, trans relatives, we'll get emails and questions about that.
Yeah.
And so don't be surprised if we don't lean on you again and say, hey, Lori, we need help.
glad to help out.
Wonderful.
So that was definitely a challenge when we came here. I came from Phoenix, and I felt like that was a little bit more of a diverse area that had more access to different types of doctors who had different experiences. I'm originally from the border area, so I left for a decade and came back. But I was very familiar with the medical care that was here beforehand. So I was terrified when we came back because I was worried that we did not have a diversified enough amount of medical professionals here that would be okay, that would work with that well. So when we first came here, the first place we started was the pediatrician. And that's really where I feel you do need to start, because they're the ones who are going to refer you out to all of the different specialties. And that would be the same even if you were PCSing to a different basis. You want to start with your child's pediatrician. That needs to be the first place that you are having that good relationship, because if you have a bad relationship with your pediatrician, you're going to have a very hard time finding what I would call trans-friendly other providers. We did struggle with that when we first came here. Our first provider wasn't quite sure what to do, and you could tell that they were very uncomfortable with the situation. So I did seek another pediatrician. When I found that pediatrician, again, it's kind of testing the waters. Is this going to be okay? And it's important. It's a different situation that many other children don't have to deal with. Because it is very personal. And so when we spoke to the pediatrician, the second pediatrician also, although he had been in practice for 27 years, had no experience with this. My child is his very first trans patient. And the reason that we stayed with him was because he was so eager to learn. His first sentence to us was, well, I'm not quite sure how to handle this, but don't lose faith in me. Someone in this city knows, and I will not stop until I find that person, and we will figure this out. And he was very welcoming. He immediately addressed my child and told her, you be you, and you be comfortable with what you do, and we're going to support you, and we're going to make everything as smooth as we possibly can. That's what made all the difference to me.
Okay.
So even though he had not personally experienced this yet, I wasn't quite sure I was going to find a physician here in this city that had. And that may be the situation that many of our military families go through when they get transferred to smaller stations, smaller places that don't have a lot of specialties. So this physician was willing to continue to research and continue to learn and educate himself. And they did, and they trained their whole office. And we've had just great experiences since we've been there because of the fact that the front office has been trained, his medical assistant has been trained. So then when we need specialties, because even a dentist is important in this, even an orthodontist, these are extra questions that people don't have to think about
right.
Unless, you're dealing with it. You ask your physician, my child needed braces. So I asked him, do you happen to know anybody? And he had his office call, and that helps because you don't always know how to have that conversation. You have to call the manager and ask them, how does your provider feel about treating a trans patient? Do you have experience in that? Is your office trained? Is your staff trained? How would you handle this situation? Because every little aspect is important. Just as I mentioned the yearbook.
Right.
When you're getting even to a dentist, when they call your child's name to come up, are they going to call the right name?
Uh-huh.
So these are all conversations you have to have beforehand, and it's just like enrolling in a school, getting a doctor. The first place you need to start is that pediatrician, and then hopefully if you have a good relationship with that pediatrician, they will slowly find everything else that you need.
Now that you mentioned it, not only are we talking about pediatrician, as a GP, but you're also looking at pediatric endocrinology and all of that
Yes.
needs to be taken care of.
Absolutely.
Yeah. And I can only imagine what it's like to be, let's say you're now having to go to Yuma, Arizona.
Right.
You know, which is it's a tiny little facility that's just outside. It's maybe about 5 miles out east of the city. If you're going to the Naval Air Depot,
Yes.
or you're going to the Marine Depot, you have nothing out there.
Yes.
And so trying to find adequate help, yeah, you're going to be digging.
Yeah, I was prepared to travel for our endocrinologist if we needed to. Luckily we found one here, so that was great, and he's amazing. But I was ready to travel just in case, and my pediatrician was ready to send me if we needed to. So
Yeah.
that's a possibility. There are many families that do have to travel for trans care. It happens.